We all agree, young people in our province deserve to have the best possible start in life. We understand that there is an urgent need to support young people with mental health and addictions across our province. And helping people early on, this is, I think, well understood, can prevent small problems from getting bigger down the road. That's why our government is doing everything we can to support young people living with mental health and addiction challenges. Just in June of this year, we announced 24 new substance use treatment beds, 18 at the Phoenix Society in Surrey for young men aged 17 to 24 with addiction and mental health challenges. For those of you who aren't familiar with Phoenix, it's located just off the King George Highway immediately south of Surrey Memorial Hospital. These beds are an important part of the integrated and seamless system of mental health and addictions care that our government is building for all young British Columbians. Early last month, the government also invested $100,000 to fund community-specific mental health and addiction resources for South Asian people in the Greater Vancouver region in partnership with organizations like the South Asian Community Hub. We understand that this funding will help people in the community access life-saving support and change lives. In addition, every year the Government of British Columbia, through the Ministry of Post-Secondary Education and Future Skills, provides post-secondary students, such as the students who attend Simon Fraser, with free access to mental health professionals. More than 100,000 students in BC have access to mental health professionals by phone and by text. The students need support. There is someone waiting to help 24 hours a day, 7 days a week, and more than 24,000 calls have been made since 2020. We've also invested a historic $1 billion in Budget 2023 to continue building a system of care that includes substantial support for youth mental health and addiction services across the province. Now, I mention these budget numbers. Sometimes they're just a little bit blurry and people really aren't able to relate to numbers of that magnitude. But the point of mentioning budget numbers is that the government has committed the resources. It's only the beginning of programming and reaching out into the community. Since 2017, we've been adding support for youth in an unprecedented way. The Foundry Network, with 15 centers currently open across the province, 8 in development and 12 more to come, will be a total of 35 physical centers once complete. I was up in Prince George just a couple of months ago. There's one in Prince George, for example. The number of communities receiving integrated child and youth teams, up to 20 by 2024, to be fully operational by 2025. Addiction services across the province to help young people and their families thrive, with 33 new and extended addiction programs supported by 130 new healthcare workers, increasing funding to support youth living with eating disorders. Children and youth have always been at the forefront of our work, including a Pathway to Hope, BC's roadmap to create a seamless and comprehensive system of mental health and substance abuse that works for everyone. In addition to the significant investments that I'm talking about to build an integrated continuum of care, we know that there's much more work to do, and that I think that's obvious, but it needs to be stated. Continued investment in upstream supports and services to stop small problems from becoming bigger down the road. Continued work to ensure timely, coordinated, and integrated services. And I think anyone who's attempted to enter or access the system of mental health supports will know that integration and a path forward through a system of programs is absolutely essential to get the kind of help that people need. It's not enough to have a thicket of impenetrable programs that people can't get access to. So that integration is really important. We're also building equitable access to supports across the province, whether rural or urban. So not simply here in Surrey or Vancouver or Abbotsford, but also in more regional centers such as Prince George, Kamloops, Prince Rupert, and the smaller towns and villages that make up our province. And the next one is a big one, breaking down barriers and stigma by acknowledging that mental health and substance use care is health care. It's not something bolted on to the system. It is an integral part of health care. It is health care. We will know that we're getting closer to where we need to be when young people and families tell us that they are receiving the right care when and where they need it. This work is ongoing, clearly, and we won't stop until we're done. We know there is much more to do to support our young people, and certainly on behalf of Minister Whiteside, I know her personal commitment. I admire her capacity for work and her resilient spirit as she tackles the challenges of her portfolio and provides the leadership on these issues that's required. And so I'm sure she would want me to say that on her behalf. So we won't stop working until every young person in our province is able to get the services they need and deserve. So thank you very much, and I will end my comments at that point. Thank you.